Hi, welcome to our first, and it may be our last edition of Off the Cuff. Off the Cuff. I have absolutely no notes, and I just spontaneously bring in a world-renowned expert to ask questions, and then this person off the cuff answers them, and then we edit as freely as we want to make each of us look really good. So if I watch TV enough, I'm thinking that everybody in the world has low testosterone, that I have to have it. So that's why I'm watching TV. Obviously, that's not correct. But when do you, because men with prostate cancer are told not to get testosterone. So what's your opinion of testosterone? How do you use it? How do you implement it into your patient program? So take me through that kind of thinking, testosterone and when and how you use it.
So testosterone, we never used it before with prostate cancer because part of the prostate cancer treatment is blocking testosterone.
That's right.
To starve the cancer cells from treatment. Well, there's a lot of data to show that men who have low testosterone actually have more problems with dying from prostate cancer than men with regular testosterone levels.
So it's not unusual that you would give a man testosterone who needs testosterone after they've been treated for prostate cancer.
Now.
5
years ago we'd say no.
Right.
So that was heresy to start that up.
There are a million ways to get testosterone, it seems now, as a prescription.
Right.
Can you take us through some of these and which ones you like versus the others?
Right. So there's gels that people use. They can be bought by, substances such as androgel. They're purchased and you buy them and they're covered by insurance and you rub them on your shoulder and they can go, there's one that goes under your arm called Axiron.
Right.
It's a little bit watery and sometimes it can go down your side and that can be a problem.
That's not fun.
There's different types. There's one that's a buckle one that goes under your, baseball players like that.
Yeah, it goes the one that goes in your mouth. That's actually true. I mean, these are all options.
And there's one that can go in your nose.
Yeah, no, that's attractive.
So, there's intramuscular. There's a new one called Avid. That's a 3-month testosterone.
Is it AVEED?
Correct.
Okay.
And so, and that's covered by insurance if you fail 2 other ones. There's one that's compounded that you can put underneath the skin, and there's one that's, it's covered by insurance that also can go underneath the skin sub-Q. There's regular depot testosterone that's been tested by a buddy of mine that's in New York, and he's going to be writing a paper on that, and it's actually given sub-Q under the skin.
So you just inject it there?
Yeah, so you do a half cc of that once a week, which is depot testosterone. That's means it's been given into the muscle, but now they've done studies and it gives good levels.
So I'm injecting here once a week?
Yeah, so you take a roll.
Are you injecting? Are they coming in every week? Or are they
no,
going
you
home?
teach the patient how to do it.
So the patient goes home and they get the syringes and then they inject themselves?
Yeah, and they do the injection and they get pretty good levels of testosterone that way.
And do guys have any problems injecting themselves in the stomach?
It's been most of the guys have done it. Some guys don't want to do it, they get freaked out.
But men are more freaked out by injecting themselves in the penis than the stomach.
Yeah, they can do the stomach.
Just want to make that official.
Yes.
So, okay, so which ones are your favorites out of all of those?
So the patient doing the one in themselves in the stomach is becoming
Really?
the more favorite.
Is that cheaper or more expensive? Do we know?
I think it's cheaper for the patient.
So if they go home and do once a week.
Yeah, and also the pellets that I do for them.
So you actually put in a pellet around their
underneath
waist?
is good for 6 months. That's probably the cheapest. Because it's about, I think it's $250 for the pellets for 6 months. It's
so you like the pellets and the injections?
Yeah. So that's probably the cheapest, but that's a bigger needle, so that but they don't probably but it's not bad for the patient. So whichever one they choose is the best one, whatever they like.
And do you find that in general, people notice the difference when they get testosterone, or is it more of a placebo thing? Because they're injecting
It can
themselves.
be both. When they see the numbers are good, they're
Right.
feeling better.
Yeah, yeah. So when the numbers get better, they feel better.
And the problems that they have, sometimes they can get higher hemoglobin, so their red blood cell counts get higher. And that can be a difficulty because they can end up, possibly, getting to a traffic jam in their blood vessels.
Yeah, too many blood cells.
So we have to have them get phlebotomized, they have to give blood off, and they take aspirin.
Yeah.
Because they get too many blood cells when one of them flip a stroke.
I mean, that's scary.
That's scary.
Tell me that doesn't happen that often.
I haven't had anybody get a stroke, thank the Lord. And,
or even these large increases in blood cell counts.
Yeah,
That's not that common.
And
right?
they have to be very, you have to pay attention to them.
Right.
They have to be very compliant to get their blood cell count, to get their PSA looked at and come in for prostate checks.
Yeah.
So some of these guys, if they're not compliant, I don't work with them anymore. They get fired because they have to be good at that.
Well, we're in California, we're in Los Angeles, where perception is everything, right? I mean, people have all these wild ideas. I love LA because people have all these wonderful ideas about health. Some are perfectly reasonable and some are absolutely bonkers. They're crazy. So, but that's true of a lot of places, but especially here where people are health conscious, right? What I see a large number of out here, which I don't see in other places in the country, are compounding pharmacies where we'll just make you testosterone. Do you feel comfortable sending people to these make your own testosterone outfits? These call them compounding pharmacies.
Right.
What's your experience with that?
Well, for the pellets, we work with this one, and they've done a good job. I mean,
Okay.
I've had an issue, with one time, and especially when we saw that scare back east or wherever that place was.
Yeah, that guy was just indicted
Yeah. No,
for a compounding pharmacy gone wrong. So that's why this is
it's
people
scary.
are concerned about some of
It's
them.
scary. It's scary.
But your experience has been pretty good?
Yeah, and I'd rather use real drugs than compounding, but it's the patients it gets kind of tough because they end up having to pay $750 versus or $1,500 versus $200 or $300.
It's expensive.
Yeah, it's a very expensive drug, so pretty good.
Mm-hmm.
So testosterone, the benefits of it are possible increase in bone strength, muscle strength. You feel better. Men think better. They think more like men. We're crazy. We're more alert. We have our, energy.
Right.
We're on it.
Right.
We're ready to go.
Top of our game.
We're not listening to our wives, we're caught in what we're thinking we're gonna do, 3 days from now or next hour or when the ball game's on.
Yeah, absolutely.
Yeah, honey.
This is all
Okay,
testosterone.
I'll be right on it. Okay. No.
So you've been happy with the results. You think?
Yeah.
Okay.
So as long as people are being monitored, I think that's a good thing.
Yeah. This has been another episode of Off the Cuff with Dr. Moyad. See you next time.